guys. Today we're going to talk about maintaining fertility on testosterone. As many of you know, testosterone in and of itself will cause sperm counts to plummet. Okay. And if you're an old guy who's already had a family or doesn't want to have kids, this isn't a big deal. In fact, a lot of my older patients are happy about it. But if you're a younger man who has not had a family yet or would like to have more children in the future, this is a real issue. And this is something that you need to work with your doctor very closely on because starting testosterone replacement therapy, even with HCG, can be a bit problematic in terms of maintaining your fertility. Okay. So a lot of young men suffer from low testosterone. It's a worldwide epidemic. I've talked about it before. But along with that, along with these dropping testosterone levels that we're seeing declines in sperm counts worldwide. The two are running together. There has been at least a 50% drop in sperm counts since the 1970s. And there's no sign that it's going to improve anytime in the near future. There's a lot of theories about why this is the case. It's beyond the scope of this talk today, but the fact is that men's sperm counts today are at least half of what their fathers were. And this has serious implications, not just for individual men, but for the continuation of the species in and of itself. So a lot of you know that HCG is commonly used with testosterone replacement therapy, primarily for two reasons. One, obviously, to maintain testicular size. Okay, you will get testicular atrophy if you just use testosterone alone. Some men care about this, some men don't. But then the other thing that it's used for is to maintain sperm counts. But a lot of patients I've come across, and actually, quite frankly, a lot of physicians too, are under the impression that if they start HCG at the same time that they start testosterone, the man's sperm counts will remain the same as they were before they started on therapy. And there's some studies out there showing that may not be the case. Okay. That they actually might drop. So if you are one of the lucky guys out there who has a healthy normal sperm count, and the normal range is somewhere, they say, between 20 and 200 million sperm per ml of seminal fluid. Okay. That number, by the way, keeps dropping. The WHO is now saying that 15 million is the lower limit of normal, but that goes along with the declining norms for testosterone levels as well. So I do not consider 15 to be normal. Even 20 is not normal. In fact, there's a chart here that I want to show you guys. Now, this graph here looks at the chance of a successful pregnancy using intrauterine insemination, or IUI. And what that means is that in a lab, a sperm sample is taken, it's treated in a number of different ways and washed, and then with a catheter that's passed through the cervix, it's deposited directly into the uterus. So it essentially gives the sperm a head start. They don't have to swim through the cervix and all that mucus. And it's used successfully for couples that have infertility issues where the man has low sperm counts, but really the woman is otherwise healthy. So, but what you can see from this graph is that the success rate for a single IUI when the sperm count gets below 40 million, it starts to drop. Okay. So it doesn't drop a whole lot between 40 and 20, but it certainly does drop a little bit. So in an ideal scenario, I mean, you want to have at least 40 million sperm per ml to maximize your chances of a pregnancy. You can see that it really starts to drop off when you get down, start hitting about 15, and as that curve moves to the left, the pregnancy rate just plummets. Okay. The problem is, if you're a young man with low testosterone, you probably also have low sperm counts. Not necessarily, but the two tend to go hand in hand. especially if your problem is secondary hypogonadism, okay? Secondary hypogonadism, if you guys remember, is where you don't necessarily have a problem with the testicle itself. You are not receiving the signal from the pituitary gland in the form of luteinizing hormone and follicle stimulating hormone, which is LH and FSH. Those levels are suppressed, and therefore the testicle is not responding with appropriate amounts of testosterone. So now, LH is needed for proper testosterone production, okay? But FSH, follicle stimulating hormone, is what's necessary for proper sperm production. And as I alluded to before, the reason, that testosterone destroys your sperm counts is because your LH and your FSH levels essentially go to zero when you're on testosterone. And the reason that you can maintain some degree of fertility on HCG is because HCG mimics luteinizing hormone and to a certain degree mimics the effects of follicle stimulating hormone at the level of the testicle. So you are able to maintain some sperm production. But I want to go over some studies with you guys that I dug up. These are pretty old studies, but you have to go back. Nobody's looking at this stuff currently, so you have to go back sometimes 15, 20, even 30 years to some of the original studies in this area to answer some of these questions that I've come across over the last few years. So I always wondered, is HCG alone sufficient to maintain baseline sperm counts, essentially, in men? And what I found in some of these studies is that the answer to that question is no, in most cases. Okay, so the first study I want to go over with you guys is called Concomitant Intramuscular Human Chorionic Gonadotropin Preserves Spermatogenesis in Men Undergoing Testosterone Replacement Therapy. All right, this is a 2013 article from the Journal of Urology. This one is kind of a big deal because it was one of the first studies that actually proved that if you start testosterone along with HCG at the same time, you can maintain reasonably good fertility levels in men, especially in young men that have low testosterone. I think a lot of age management and HRT physicians, we already knew this, but this was one of the first studies that actually documented it and proved it back in 2013. So real quick, they took 26 guys, average age was 35.9 years, all with low testosterone levels. They were below 300. Their total testosterone was below 300 nanograms per deciliter. Their average sperm count was 35.2 million per ml. Okay, so technically normal, but certainly on the low end of normal, kind of what you'd expect for a 35, 36-year-old man with a testosterone level of 300 or less. They're not going to have great sperm counts. What they did, they started these guys on a decent dose of testosterone, 200 milligrams IM every week of, I believe they used testosterone enanthate, which, as you guys know, is essentially the same thing as cypionate. And then they used HCG, and they gave it intramuscularly. You guys know you can do it subcutaneously. It works fine. 500 IUs, I believe it was, every other day. And that's a perfectly reasonable way to do HCG. You can do low-dose HCG either every day or even smaller doses every day. But more commonly, you'll see bigger doses like 1,000, 1,500, even 2,000 IUs twice a week. And that seems to work just as well. So, but they chose to use 500 every other day. It's perfectly fine. So what did they find? Interestingly enough, so they had a baseline of 35.2 million, as I mentioned before, sperm per ml. In the first 60 days, the average sperm count dropped to 22.9 million. All right. In the next 60 days, it dropped a little bit more, 20.7 million. Okay, still technically within the normal range, but this is a decline from their baseline. And interestingly enough, for reasons that are a bit unclear to me, over the next 180 days, the sperm count average kind of gradually climbed back up again. So that at the end of a year, the average sperm count was 30.2 million. Okay, so, but still less. So less than the 35 million that these guys started with. So now, is that enough of a drop to, make these men infertile, to start giving significant difficulty in these men impregnating their wives and having children and doing all the things that they want to do to start a family? I don't know. I don't know. Possibly. There's it's certainly possible. But the take home point here is that these guys, with HCG, they did maintain normal sperm counts, but they were lower than their initial baseline. Okay, and that's kind of the take home point of this talk today is HCG is absolutely mandatory if you want to maintain fertility when you start on testosterone. It doesn't necessarily mean that you'll end up with the same sperm count that you had before you started testosterone and HCG. Okay, so here's another one that I thought was interesting, because it shows kind of the same thing, but although a little bit more dramatic. So the first study, these guys had low testosterone and relatively low sperm counts. In this one, these guys were actually quite healthy, and had very, very normal sperm counts. Their average was 88 million. Okay, that's really good. I mean, especially these days. All right. So they did a protocol with these guys where they did 5,000 IUs of HCG twice a week for 7 months. Okay, so that's a big dose of HCG. It's probably higher than they needed to, but for whatever reason they did that. And these were the results. So what was their sperm count after the conclusion of this study? And this is with just HCG alone, by the way. Dropped to 22, an average of 22 million. Okay, from 88 million to 22 million. That's a big drop. Okay, so it's a little bit unclear why these guys had such a big drop. It may be that these guys were healthy and had high FSH levels. They didn't specifically mention what their baseline FSH was, and these other guys in the first study I mentioned had low FSH levels, which is part of their problem. So it may be that if you have baseline low FSH levels, that you can maintain pretty close to where you were when you start on HCG. But if you have very high FSH levels and a very good sperm count, that HCG alone is not going to cut it. So the interesting part about this study was they were wondering, okay, if we add in FSH, can we improve these guys' sperm counts back to where they were? Is FSH the missing piece of the puzzle? And it turns out the answer is yes. All right. So HCG at first for 7 months. Then, just to see if there was an effect from testosterone, they added 200 milligrams of testosterone. I think it was also enanthate once a week. And then they checked their sperm counts. So HCG 5,000 twice a week plus IM testosterone once a week. No change. So they were still sitting right around 22 million. And then, interestingly enough, they added in either recombinant FSH, okay, or something called human menopausal gonadotropin, okay, which is HMG. HMG's been around a long time, but HMG is basically purified urine from postmenopausal old ladies, and it contains both FSH and LH, or in some cases HCG. It kind of depends on where you get it. The brand name, the most common one in the States, is called Menopur. But it's quite expensive. Recombinant FSH is extremely expensive. It doesn't get used very much outside of fertility clinics. Now, the dose that they use for these is a bit unusual. So the recombinant FSH, they use 100 IUs subcutaneously daily. And then the HMG was 75 IUs daily. So that's a bit atypical. Usually those medications are dosed on an every other day schedule, or like a Monday, Wednesday, Friday. But again, for whatever reason, that's what they chose. But here's the interesting part. These guys who went from a sperm count of 88 million down to 22 million while on HCG and testosterone, when they added back in recombinant FSH or HMG, their sperm count skyrocketed. It went up to as high as 103, so even higher than their previous baseline, which is pretty fascinating. So here was their conclusion, and I completely agree with it. It says, in summary, we found that prolonged selective FSH deficiency induced by HCG results in partial suppression of spermatogenesis. Absolutely. And that FSH replacement results in stimulation of sperm production nearly to control levels, and actually went higher than control levels in this particular case. So, so that's super interesting. It proves definitively that if you're going to be on testosterone replacement therapy, HCG alone may not cut it. Especially if you have borderline sperm counts, you may need to, when the time comes, if you want to start a family or have another child, your doctor may need to put you on either HMG or FSH in addition to HCG. Okay, so that's going to cost you some money. Okay, just the way it goes. All right, so. Another interesting study that I wanted to share with you guys is recovering sperm counts in men that have been just on testosterone. So, in an ideal scenario, your doctor should definitely find out if you have any plans of having future fertility. Okay, if you're a young man and you think you might want to have kids one day, maybe you haven't met someone yet that you want to have a family with, but you might want to in the future. That is a vital piece of information, okay? Because you definitely want to start on HCG at the same time that you start on testosterone. It can be very difficult to recover sperm counts after you have been on testosterone for quite some time, because again, you've completely shut down your production. Your LH and FSH are zero. The the testicles have atrophied. You may have even lost some of your Sertoli cells. But it's not impossible to get back some degree of fertility. Okay, so in this study, this was pretty interesting. So they had a small group of guys. Their average sperm counts, it looks like, were somewhere between 60 and 100 million. So totally healthy. By the way, this is Journal of Andrology back from 1985. Journal of Andrology is great. I highly recommend it. And then, so they took these guys who had very decent sperm counts, and then they just crushed them with testosterone, no HCG initially. So they put them on testosterone enanthate, 200 milligrams. And what they found, they kept them on. Obviously, they kept them on that. It looks like for 9 months. Okay, a decent dose of testosterone for 9 months. Sperm counts went down to essentially to zero. Okay, as you would expect. LH levels, FSH levels down to zero. Okay. Then what they did is they added back in HCG, and they did it again at kind of a high dose, higher than I typically prescribe, 5,000 IUs, IM 3 times a week. Okay, and as you can see on the graph, you see their sperm counts just plummeting, and then once they start them back on HCG, they slowly start to rise again, but they don't rise very much. It looks like the highest that they got was maybe 20 to 25 million. Okay, and this is from a prior baseline of between 60 and 100 million. So you can recover some degree if you're completely shut down. And then again, this is assuming you had a normal, like healthy, robust sperm count before you started on testosterone. You can get some of this back. The problem is, what if your baseline sperm count is only 20 million or 15 million, which these days a lot of guys have that and they don't know it. Okay, well, as a percentage of this, I mean, you may only get 5 million back. Okay, and that's not going to be adequate to father a child without some serious reproductive help. Okay, from a IVF specialist. That's just the way it is. So just keep that in mind. If you have any thoughts of future fertility, please start on HCG right out of the gate, or just this is beyond the scope of this talk, but there's other options. You can potentially try Clomid, or you can just wait. okay? You can try to fix your lifestyle, all right? Try to lose that 75 pounds of fat that you're carrying around, which is what's crushing your testosterone in the first place, okay? So, but you just don't want to be in a situation where you have been on testosterone for many, many months. And I've had patients referred to me like that, young patients in their 20s, which is hard to believe, who were never told by their primary care physician that started them on testosterone that they would have fertility issues as a result of that. And so then it becomes, there's a lot of work that needs to be done to try to get them fertile again, okay? A lot of times it involves them coming off of testosterone and starting up on HCG and then adding in HMG or recombinant FSH, which is extremely, like I said, extremely expensive. And it probably will not be covered by insurance, unfortunately. So these are all really, really important conversations to have. You got to have a physician that manages your TRT who understands this problem. Okay, you don't want to go to just a doc in the box testosterone mill, managed, by a mid-level provider who may not understand the intricacies of this. You want to go to somebody who's an expert. Okay. The final graph that I wanted to show you guys is from another study that sought to figure out if once you recovered a man's sperm counts using HCG and HMG, could you maintain them with just HCG alone? Okay, so what they did is they took a cohort of men and they brought their sperm counts down to 0 by putting them on testosterone, just like in the previous study. Okay, once their sperm counts were determined to be down to 0, they took them off of testosterone and put them on HCG and HMG, and predictably they had a really good rise in their sperm counts, essentially back up to baseline. And then they took away the HMG and they wanted to see, okay, could the HCG alone maintain the previous sperm counts that they got while on HCG and HMG? And as you can see by the graph, the answer to this question is also no. Okay. Now they did maintain some degree of fertility. Okay, HCG it did keep sperm production going at some level, but you can see that it's quite a bit lower from the baseline. In this particular case, it looks like less than 50% of their baseline going out to 24 months on HCG. Okay, so HCG is a good drug. I do recommend it for most guys, unless they're elderly or for whatever reason they don't want to be on it. But it's an absolute must for men that want to maintain fertility. The other thing that I really push for young guys, and you guys don't want to do this, I get it. I've had to do this. I didn't want to do it either. Is you got to go get a semen analysis. Okay. Highly, highly recommend if you have any inkling that you may want to father a child in the future and you're going to start on testosterone, you need to find out what your baseline sperm count is. Okay. And a semen analysis is really useful because it can tell you other things besides just your counts. Okay. Morphology, motility, and there's things that can be done to improve all of those things. But it's important to know, and and if you do your analysis and you come back and you got 75 or 150 million sperm per ml, then cool. I mean, HCG alone, HCG is probably going to be fine. The drop that you'll get in those counts, it probably will not be significant enough for you to have any sort of fertility impact. However, if you're one of the many, many millions of men out there that have low or borderline low sperm counts, we're talking 20 million or less, you need to know that, okay? Because you may still want to go ahead and start on therapy, and that's fine. I completely understand that, but you don't want to be shocked, 5 years into therapy, and after trying with your partner for 4 or 5 years to get pregnant, you don't want to find out then that the reason is that you've had low sperm counts all along, okay? Because again, then you've wasted all those years. So I get it. It's embarrassing. You have to go to a lab. They give you a little cup, send you off to the bathroom. You got to do your thing. You got to come out with the cup. Again, I've done it. It is what it is. Just suck it up. Just be a man. Just go do it. All right. It's a really useful piece of information. I don't make it mandatory in my practice, but again, I strongly encourage guys to do it. Go to another town if if that makes you feel better, because you don't want to run into somebody you know. I don't know. I don't care. But just get it done. It's super important. Okay. I hope you guys found that helpful. Again, HCG. It's a fabulous medication. It's getting a little harder to get a hold of thanks to the FDA. Way to go, guys. It's still available, but you're probably going to be paying more for it now, because it's got to come from the big pharma guys, okay, and they're gonna jack the price up. The other thing to keep in mind is a lot of guys are being switched over from HCG to gonadorelin, thinking that it's going to do the same thing. Not likely in terms of fertility, in my opinion. Okay, we need more studies on it, but I was not able to find any good studies that gonadorelin and the way that it's being dosed with some of these TRT clinics is going to be sufficient to maintain fertility. You probably are going to have to be on HCG, and keep in mind, if you've got low baseline counts, you're probably going to have to take some HMG and some recombinant FSH. And don't be surprised if your doctor looks at you kind of funny because they've never heard of those medications. Okay, they don't get used very often, but if you're a physician that prescribes testosterone, you need to not only know about HCG, but you need to know how to dose HMG and recombinant FSH, and you need to know it backwards and forwards. Okay, all right, that's all I have for you guys. I hope you found this useful. Take care. Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.